Patient who's been on a long-term benzo use, I really feel it's important to just do gradual small reductions as an outpatient. Get them on a long-acting benzo. So if they're already on Valium or clonazepam or something, that's good. If they're taking Xanax, we usually try to get them on something longer so they're not having interdose withdrawal. But really try to just do a small, 5 or 10% reduction every couple of weeks, once a month. And I think that's the safest and most effective way to do it when possible, because the benzos are just so sticky that the changes that they incur on those GABA receptors are like mud, man. They just don't let up. So that's my preferred treatment. Now, if somebody comes in post-acute withdrawal, like say they got off benzos already a month ago or 3 months ago or 6 months ago, then that's the magic of NAD, right? So to answer that question, that's an easy answer, and I'll just try to do 10 days of IV NAD. Now, that is very, very helpful. But that has a price tag to it. Not everybody can afford that. It's very expensive. You're looking at $1,000 a day, so that's not, available for a lot of people. I like gabapentin, and I like clonidine actually quite a bit, because that whole hot, cold, and autonomic dysregulation and tinnitus and weirdness, that whole sort of autonomic instability seems to be more regulated by clonidine. I do like gabapentin. I think that's pretty helpful. It's a CNS depressant working on the GABA receptor. It's a different receptor it's a different receptor on the GABA system, but it's still, part of that same fork. So that's why that's helpful. I think that there's a lot to be said for sort of Wim Hof breathing and activating your parasympathetic nervous system. And to take that a step further, it would be cold water immersion. I know it sounds crazy, but for people who are already in that camp, when you can really start to access your parasympathetic nervous system, that helps reset your brain too. But medication-wise, I'd say NAD, clonidine, gabapentin, phenobarbital. If we get into that situation, we'll use phenobarbital. If I really have somebody who's difficult to manage, I'm trying to keep them out of the hospital. If there's any vital sign abnormality, or I'm concerned about a seizure, or we need to do a more accelerated detox for some reason, then phenobarbital is totally safe. And that's a sedative that targets both the glutamate and GABA system, and I think is very helpful for suppressing some of those symptoms. So I think those are probably all my go-tos. And obviously we do some nutritional infusions that I think help restore some of the underlying nutritional problems, like the Myers cocktail and the Nourish, and we'll give pretty good doses of IV, vitamins and minerals and zinc and some essentials and